Okay, so I will start by preparing my medication according to the 6 rights. So right patient, right medication, right dose, right route, right time, and right documentation. And then I will check my MAR for my orders. So I will be giving a intramuscular injection using the Z-Track method, and we'll be doing it in the vastus lateralis muscle. So I'll need my diluent and the medication we'll be mixing it with. I'll need a needle and a clean surface to do all this on so that I can set this needle down while I use the needle on here to put the diluent into the powdered medication. So for this medication, we'll need to get 1 milliliter of diluent to add to the powdered medication here. So we'll drop 1 milliliter of air. This is after I clean the top of the medication vials. And then we will insert that air. And then we will draw back the 1 milliliter here. Okay. And then into the clean powdered medication, we will insert that. And then we'll recap. Technique, and then we will dispose of this needle in the sharps container. So get it off, there we go. Okay, and then we can recap this new one here, there we go. And then we'll roll this between our hands until all the particles are dissolved, and it's ready to be given. Alright, so there we go. And the order is for 1 milliliter today. So we'll draw back 1 milliliter of air, uncap our needle. We'll clean the top of this again with an alcohol prep pad. Put that in there. And then we will draw back our 1 milliliter of medication here. Try to get all the air bubbles out. Okay. There we go. And we'll recap using the one-handed technique here. Perfect. Okay. So then I will get my alcohol pads and this stuff. And we'll go into our patient's room. We'll use 2 patient identifiers, so name and birth date. And we'll explain to them what we're doing. So we're going to be giving an intramuscular injection in their vastus lateralis muscle. So I'll have them laying down or standing up. From hand hygiene, put on a clean pair of gloves, maybe. There we go. Okay. Okay. We'll open up our prep pad here and identify the spot that we're going to use. So just a nice muscular part in their vastus lateralis muscle. Then we'll allow their skin to dry. And we'll uncap our needle here. And with our non-dominant hand, we will pull their skin, displace the top of it, insert the needle, aspirate, make sure there's no blood return, which there's not, so we're good to go. And then we will inject this medication. Okay, and then we'll let their skin go and go back over that injection site. Dispose of that in the sharps container, and then I will go back and document what I did.